going to work our way up the spine first, but when you come back to a foot, it's always worth just doing a few of these downward strokes. Okay. Just to maintain that mobility. And here, you're just gently pushing your thumb and then pushing in. So it's like a caterpillar. You're pushing up and in, and it is a tiny, tiny movement, and you really don't need much pressure at all. And this is just working our way up the spine. Okay. And then we come back down. Sometimes you can feel a small crystal. That's actually a build-up of toxins. The feet are reflecting the body. So it's normally the case that if you found a crystal in the foot, say in the spine, it would mean that there's tension in the back. So by breaking the crystal, just with gentle massage, you can circle or just carry on doing this thumb walking. It will allow the body's natural energy to flow freely through the body, so you're removing tension in the rest of the body. Feet do reflect the body. Just working up the spine. This is the lower back up to the neck here. Okay. Should take a bit of care when you go across here. This is sometimes very tender. So you can just release off the pressure at that point. Okay, then we're just going to work around the head. So that's the big toe. Go around here and then just change your grip. Thumb walking does take some practice, but once you've got it, it's very easy. If you're not happy using your thumb, you can use your forefinger. Actually not uncommon to feel crystals around the big toe. Okay. So we're just going to work down the head. So you're holding one hand behind the toes, so you're pushing on your own hand. You're not pushing on the foot. You're using your hand. And then change hands and come back. Ideally, you want to do 5 lines down the toes, but if you're working on a child or somebody with smaller feet, 3 or 4 is fine. But if they've got big toes, go for 5. So we'll move on now to the sinuses. Once again, place the hand behind the toes and just gently circle the pads of each toe. Now, this is where some people might find that they're rather ticklish. If they are very ticklish, it's not worth doing it. Just move on to the next exercise. In time, they probably get used to the feeling, but just a little and then come back to it. Because ideally, you want the person to relax as much as possible. And throughout the whole treatment, you want to encourage that. Make sure they're warm enough. If you're working inside, it's worth covering the foot so that you're not working on, and then uncovering it again when you begin to work on the foot. You can just cover it with a towel or something. Okay, I'm going to work across the shoulder line here. And all the way across. It's also got ear, nose and throat along here. And then going down here. And then round this pad. So this here is the shoulder. Actually some tension here. And you can normally feel tension in this area. And you just gently circle it. So you place your thumb on and just gentle circular movements. And then we work our way back. We're just going as far as the big toe. And then coming from the big toe, once again with this thumb walking, round here. And you can feel there's a natural pad here. You'll find that in the foot. And then we'll come back across. Now continue with the thumb walking, drag the thumb back and continue again. And then drag your thumb back. So this is working on the chest area. So we're working on lungs. And you can normally tell if somebody's got a cold, or maybe if they're a smoker, because this area will be congested. Back across towards the big toe. You can do this a few times. Okay, we're just going to work round this pad here. So you just follow the natural path, really. It really doesn't take long before everything appears logical and you think, yeah, that's right. You know when it's right because you can just tell you're not working against the foot, you're working with it. You're going round here, round in that shape. This is all thyroid area. It's not uncommon for the person who you're practicing on to actually feel pain. You're not applying much pressure, but you can feel pain in the foot. And just ease off the pressure and maybe come to a circular movement around the area where the pain was felt. And then go back to thumb walking. There's no point trying to break up every crystal you feel the first time. You'll be releasing all the toxins back into the bloodstream, and you just take a bit of time. You can always come back and continue to work. Okay, we're going to work across the diaphragm, which is across here, with the solar plexus is in the middle. So we're just working all the way across. And coming back. And it's much easier to work on the feet. You can work on the hands if somebody's got a foot injury, or even if they've got a verruca. But the foot's much more accessible, and she fits very nicely into the hand. And then I'm just going to circle here on the solar plexus. And we go back across. Sometimes if you feel a bit jittery or you have the butterflies, it's worth just gently massaging here, and that will help relieve that. Okay. And I'm just going to work across the internal organs. So we've got the liver on the right side, stomach on the left. So we're just thumb walking across 3 times, sliding back, and on the third one sliding down diagonally. So again we're walking across. 1, and then diagonally up. So again, so here we are. And most things you do work them in 3s. 2, 1 more, and then we slide diagonally down and across, back, and diagonally up. Okay, at any point during the treatment you can come back to these Reflexology relaxing moves, and it's quite nice from time to time just to come back to a couple of these just to maintain contact and just to keep the foot nice and relaxed. And we go on to the other one.